in the process of doing contact tracing to identify others who may have been exposed. Our guidance at this point is, except for those in prolonged close contact with individuals diagnosed with COVID-19, that other people should pursue extreme social distancing, attend to hand hygiene and cough etiquette, limit congregating when in proximity of other people to maintain a distance of 6 to 9 feet, and others with incidental contact with those who have been tested or have been diagnosed with the virus should be alert to the symptoms of COVID-19 and contact their healthcare professionals if they have concerning symptoms. This brings our total of test results back to 126. So 5 of those 126 are positive. We anticipate additional test results to return throughout the day today, but there are approximately 500 additional test results still pending from residents of St. Joseph County. And we will keep you informed as more information is available. I'll turn it over now to Nancy.
Good morning. As many of you know, the spread of this virus occurs exponentially, which means that while the number of positive cases at just 5 is still low and our healthcare facilities still have capacity, this situation can get out of hand fast, as we've seen in other cities across the nation and around the world. The Center for Disease Control and our local health officials recommend extreme social distancing measures, as well as washing your hands regularly. If you are exhibiting symptoms, stay home and call your healthcare provider. The county hotline at 211 is available for those who don't have a healthcare provider. The best piece of advice that I've heard over the past few days is that act like you have the virus already, and thereby reducing the spread to others. Research into the virus's spread has found that in many cases it is aggravated by individuals who have it but do not exhibit the symptoms. We are now at a turning point where additional measures are necessary to prevent the spread of COVID-19 in the South Bend region. I, along with our county commissioners, are declaring a local disaster emergency effective at 2 p.m. today and issuing a travel advisory at the watch level, which means essential travel only. This travel advisory will still allow people to travel for essential reasons, which includes going to and from work, going to the grocery store, picking up a prescription, visiting the doctor's office, dropping your kids off at daycare, picking up food from a restaurant, and traveling for emergencies. But traveling to visit friends or going to other places where people congregate is now no longer allowed. What's important right now is that we work to slow the spread of COVID-19 in our community, and by avoiding unnecessary travel, you can play a role in protecting the vulnerable members and our vulnerable neighbors. Please follow these directions. These measures only work if everyone follows them. We don't want to have to enforce travel restrictions, but we will if we have to. On Monday, our Common Council will be considering an additional appropriation of $500,000 for use in preparing our community to combat this threat. That money will be used to purchase necessary supplies and prepare facilities and other things for responding to the spread of this virus. While we continue to take measures to contain this threat, the economic impact from these measures are already mounting. Thousands of furloughs and layoffs have happened in our community, and nearly 100-year-old businesses that survived the Great Depression and every recession since are on the ropes as well. The President just signed a package that includes a number of things that Representative Walorski can speak to, including 14 days of leave for workers, unemployment insurance coverage, and free coronavirus tests. But we know that is nowhere near what is needed and is just the start. Talks on a substantial federal stimulus bill are proceeding swiftly. I've talked with the governor's office, and they're contemplating unprecedented steps, and we are contemplating unprecedented steps at the local level as well. There are some other resources already available to workers out of work, make sure you file for unemployment at the Department of Workforce Development. To small businesses, please check in with the Small Business Development Center to report the economic impact your business expects to see and find out what disaster relief is available. I also want to announce the rollout of a new tool on the City of South Bend website, which will help residents connect the different resources and support being provided by agencies, organizations, religious institutions, and more during these unprecedented times. You can access this tool on the city homepage, southbendin.gov, or by heading directly to the link southbendin.gov/COVID-19. This list of resources and support will be updated throughout the duration of this crisis by my staff. If you work for an organization that is providing support, you can submit information to be added to the list. It's important that we support each other through this time, and that's why my team will continue to work to connect residents to vital resources that they need. And as I mentioned earlier, the city will continue to provide the essential services you depend upon: clean drinking water, trash pickup, public safety, and EMS. We will get through this difficult time together. Thank you.
Thank you, Mr. Mayor. I just want to assure all the residents of St. Joseph County that there is a seamless operation happening right now between the federal government, the state of Indiana, and every local county in our jurisdiction. I can't say enough of how incredibly professional and quick the mayor of South Bend has been, Mayor Mueller, and I can't tell you enough of how St. Joe County Health Officer Mark Fox, Dr. Fox, has taken this and is leading an entire community in keeping ahead of this. And I can't say enough to just re-emphasize, we have to stay home. You know, this is working on a national level. With this social distancing, it is beginning to work. We have 2 weeks to head this literally invisible war off. South Korea has done it. We're trying to do it as well. But I can tell you, when we talk about the force of the federal government being open to assist states, and then for states to assist local municipalities, that's exactly what's happening. We have a seamless team. We are working in an incredible way. We're delivering resources as quickly as we can get them to our county health departments, our hospitals, and we are working as a team. And I would just, if I could just implore one thing into all the residents of St. Joe County. We've done this before in the blizzard of '78. We know what it's like where we can't get out, we can't drive, we take care of our neighbors, we check on people, and we do it in a very, very calm way. We're going to get through this. And our economy will bounce back when we get through this. But we've got 2 weeks that is set before us in a very strategic manner, and I would just implore every resident of St. Joe County to listen to what they're talking about with traffic. Only go out if it's an emergency. Let's not clog roads. Let's not be out looking for people to hang out with. Let's stay at home, take care of our families, and do exactly what we're hearing from our local officials, the mayor and the county health officer.
Thank you, everyone, for being here, and thank you, Congressman Włodarski, and thank you very much, Mayor Mueller, for your comments today. I can assure you also, as a state senator, that I have been in constant contact with the governor's office, with members of my leadership, and within our caucus, and I can assure you that what our intent is to do is to provide concrete information as to how this virus is spreading, what the things we can do within our community, the type of things that we're thinking about with unemployment benefits and insurance, also with dealing with the situations of making sure that our children are going to continue to be fed in coming from the schools. They're doing an excellent job on that, and also trying to deal with further situations when we want to talk about how further if there were to be food shortages. The thing is that we can get through this together. I am a firm believer that the expression of concrete evidence and truth is the one way that we are all going to stand together. People are going to want to feel assured that the things that are taking place that we can accomplish, that those tasks are at hand. So again, it is about the social distancing. We have to implore every means, and we all have to understand we are all responsible. Those that feel well and the younger people, or anyone that just is not impacted by this virus where they may feel it, can pass that on to someone that could be very, very adversely affected, even to the point of where they could die. So we have to be very serious about this. This is serious, but it is something we can get through, and we will get through. And that is what we have to bring to you, is the assurance of that. Thank you very much.
Mayor, can you talk about what exactly a watch level local state of emergency means in terms of enforcement and what the other levels could potentially be?
Sure. There are 3 levels that local units of government have, and there's the first is an advisory, I forget what it's called, an advisory, just more that's a localized issue. Normally for floods, like if an area was flooded, we could issue that advisory. The next level is the watch level, which is the one we're looking, that we're going to put in place at 2 p.m. today, and that limits travel to essential travel only and starts to activate all the emergency plans from different organizations. The next level is the travel warning, and that's the highest level, and that's where we can stop travel outright. And so that's what we mean when we say we need people to follow this so we can get ahead of it, because we don't want to have to enforce this, but we will if we have to.
What sort of penalties could people face if they are caught, doing non-essential travel?
I believe it's a number of fines. But in this case, I would ask people to consult their legal counsel. You could be liable for putting people's lives in danger.
So in the watch level, you're just essentially looking for people to voluntarily cooperate with what you're asking at this point.
Right, we're saying we're moving toward this time where travel is going to need to be more and more restricted, and we don't know what may come down from the state or federal levels either. They have other powers that may put measures into place as well.
Are we unique in imposing this travel?
The city of Indianapolis has done so. I don't know about other places in Indiana. So just right now the county, South Bend, and Indianapolis, as far as I know.
Is there any specific reason why it'd be needed here and not elsewhere?
Well, like we said, the threat rises exponentially. So we typically think, when we look at problems, we think of them incrementally. So we say, okay, we had 1 case, now we have 3 cases, now we have 5 cases. But if you wait to see, if you're looking at that kind of incremental, you're going to fall far behind. And so now that we've seen this increase, I believe that's why the city of Indianapolis did it. I don't know, I haven't had that conversation with Mayor Hogshead, but I believe they did those measures because they started to see movement up the exponential curve.
Have any state officials encouraged this action to take place?
Well, this is following guidance from the CDC and President Trump, who has discouraged discretionary travel across the nation.
Can you talk a little bit about the appropriations bill that you're talking about with Common Council? Can you talk a little bit more specifically about where that money would go?
So we don't have a lot of finalized things, but there are a number of issues that are mounting in terms of what supplies we need to stay ahead, facilities we need to keep residents safe, particularly our vulnerable residents, as well as just some contractual things the city needs for overtime and other things. So those are the kind of things we're anticipating, and happy that the council is looking to take action on Monday.
Facilities for vulnerable residents, what do you mean by that exactly?
So there are some, we are exploring with homeless service providers the ability to separate those who come down with the coronavirus and those who don't, to make sure that it doesn't spread throughout the community.
Separate facilities, separate buildings?
Right.
Is there any option for, you have a lot of people in this community, just South Bend alone, that are out of work because the restaurants and bars are closed. Is there any option for relief for them at all?
We are taking a look at what we can do there. The local governments have a lot less discretionary dollars than federal and state levels, but we've already announced that we will suspend shutoffs, and we will look to see what else we can do. And we know it's an urgent matter, and we know the local government's going to have to do something unprecedented just like the federal and state levels.
Has there been any expansion on the availability for testing, or is it still the same prerequisites to getting approved to be tested?
That's a question for Dr. Fox, but I mean, my understanding is the tests will become more available, and with the federal bill that just passed and signed by the president, they'll make those tests available free.
In terms of the examples of essential travel, it seems like picking up food from restaurants is somewhat different than those other examples in terms of going to the doctor and going to the grocery store to get essentials. Did you include that in the exceptions specifically because of the local restaurants and bars that are hurting right now? Can you talk a little bit more about that?
Well, I mean, we hope people have gathered some food supplies anticipating this, but food is an essential function and service, and some people may still need to go out and acquire food from restaurants. So certainly we want to be cognizant of the economic impact, but also there are basic needs that still need to be met during these travel restrictions.
Are people allowed to walk out of their house instead of drive, say walking down sidewalks or parks?
If we can maintain social distancing, I mean, we understand there's a psychological need. I mean, being cooped up for long periods of time is not good. But this is where this is the direction we're heading. And so the sooner we can get ahead of this curve, the less likely we'll have to take some of those extreme measures that you've seen in other cities where people have been on lockdown.
Is that what you're recommending right now, though, that people just stay in their homes as much as possible? Like, can I go out in my yard with my dog? Like, what is sort of the line?
If you're not coming into contact with people, such as if you have a big enough yard and it's not crowded, that would be perfect. Go outside, enjoy the weather. But where you're coming into contact with people, we need that to be limited to essential travel only.
Can you talk about what it's like to try to balance, protecting the public health in terms of avoiding the spread of this, and, as a mayor, sort of being somewhat of a steward of the local economy, making decisions like advising against travel to businesses like, furniture stores and clothing stores and things like that, and what the effect is on local.
Are we closing all the businesses or no?
Well, that's right now not a power that I believe the local official has where we are in terms of the emergency, but the health office can make closures, and just as they've done it in other cities. But yeah, that's the tough issue. You have two real immediate impacts. You have this threat of the virus, and you have the threat to our economy. And as you've seen, where we are right now is the fastest way to get our economy back going is to get a handle on this virus. If you look at what the markets are doing, they're crashing because they don't know that are we going to be more like South Korea, or are we going to be more like Italy? And so the fastest way to get the economy back on track is to make sure we get a handle on the virus. So, but yeah, that's why I think you've seen, there are some who might say we should have closed everything down a couple weeks ago. But we know once we shut things down, there are real economic impacts that mount pretty quickly. And like I said, a lot of workers are already out of work. And there are some small businesses here that have been here for nearly a century, gone through many recessions, who are on the ropes and they need help.
Senator, is there discussion of like a special legislative session to try to pass some aid at the state level?
There has not been direct talk of anything, let's say within the next 3 days or 4 days. There are all options on the table. There is talk that the possibility of a special session could become necessary, and that is in regards to just a whole host of things that we haven't even begun to encounter yet. So I can't tell you that I anticipate something very shortly, but as we can see, day by day, this matter changes. So 3 days from now could be the context of when we talk about this, of course. We're also going to have to talk about how that if there's a special session, how we come together, and we also try to make sure you keep the social distancing, But what I have said, and I think what is impending more than anything else, we as elected officials in our rights, we are now, and we have been, the leaders. We are leading during these unprecedented times, and we, in our case, our leadership must take into account over 6 million Hoosiers. So that has to be the very first consequence we think of. We have to take care of Hoosiers and do everything within our power. So there certainly is. That the context of the special session is something that we have begun to discuss.
What are the possible necessities that you alluded to that would require a special session?
Well, as I spoke about earlier, the possibility of just what would be the methods of distribution to make sure that not only our children are being fed, but Hoosiers are being fed. There are so many people right now that are without a job, and they are living paycheck to paycheck. And it's not just about simply, going to the store and trying to have 2 weeks worth of food. We know that some people have not been able to do that, and that is it's not some, it's going to be a great many. So we're going to have to take those things into concern. There is a great deal of additional resources that the governor can explore right now. He has a lot of power to begin the process of different things that we're going to be necessary, but there's not all. He does not have the opportunity to do everything. Some things may take the act of a special session. I'm aware that the governor's office has already begun speaking about some of these things, and we as elected leaders in the House and the Senate are beginning to talk about these same things, but in the context of laying out those issues directly, we have not got into beginning to gather the list, let's put it that way. But that's not something we're behind in either. We know the type of issues. Also, as far as housing, we want to make sure that that people are going to be able to not have to worry about how are they going to come up with a mortgage payment, or for those that are renting, we want to make sure that that they cannot be put out into the streets. We're going to have to make sure that we all come together as Hoosiers and Americans to make sure that we look out for each other. These are unprecedented times, and we have absolutely got to take care of these measures.
When you talk about making sure Hoosiers stay fed, I mean, does that look like potentially some sort of state unemployment benefit, or?
I know that with Congressman Walorski, as she stated, they've already, I believe if she wants to talk about
Sure.
that, they've begun the unemployment, and that's going to work through the state, yes.
I literally got a summary, just as we're standing here, on the federal money that's going to be starting to be pushed out into the states. It's going to make sure that we have free diagnostic testing for coronavirus, vital health care resources, which I spoke about earlier, 2 weeks of paid emergency leave for workers who are quarantined or receiving treatment for coronavirus or caring for a quarantined family member, provide 10 weeks of family leave at a 2/3 rate for workers caring for their children due to school closures, reimburse businesses for the cost of paid leave through refundable tax credits, strengthen nutrition assistance, including for low-income households and children whose schools are closed, and that includes really beefing up SNAP. This is the Food Assistance Program, and there's USDA money flowing through there as we speak. So the Senate just voted on this bill yesterday. The President will, if he hasn't signed the bill, will sign it today, and that money will begin moving out into the states, and then from the states it's going to be disseminated here. So I can tell folks that within, I would say, probably the next few weeks, we're going to see those financial sources coming. I've been in touch with our local food banks and the folks that are providing meals for all of our school children that normally eat at school, and they gave me a double thumbs up that our resources are strong right now when it comes to feeding kids, and they know that I am their advocate to make sure that that federal money is flowing into the places that it needs to go from the state level into our communities here. So the door's open, the bill is passed, it's moving through right now. And so again, I just can't tell you enough how this team has been incredible when it comes to sharing information. We all have our parts that we're responsible for, and we're working as a team, and we're getting the resources we need. And now that the federal bill has passed and that federal money is going to start coming through, there should be a lot less worry on the side of employees and employers as well.